Hi everyone, I'm Dr. Mayur, and today we are breaking down something that lakhs of men have, but they don't know that it exists. It's gynecomastia. Gynecomastia is an enlargement of the chest. It's not fat, it's not laziness, it's not lack of exercise. It's basically hormonal imbalance. This hormonal imbalance is between estrogen and testosterone and occurs at puberty. So, what causes gynecomastia? Gynecomastia is most commonly caused due to an hormonal imbalance during puberty. But there are certain drugs such as anabolic steroids that causes gynecomastia. There are also certain illnesses like liver illnesses which results in abnormal enlargement of the chest. So here's the crazy part. You can work out as much as you want, you can diet as well as you can. But that gland, which is because of the hormonal imbalance, will never go. So let's clear up certain myths about gynecomastia. It's not always caused by overweight. You cannot burn it out with a good chest day or a more frequent chest workout. And it's not always puberty related. A lot of men can develop it later on in life due to certain medications or lifestyle changes. So no, you do not have to suffer in silence or feel embarrassed. Gynecomastia is a medical condition, not personal failure. Let's talk about treatment options for gynecomastia. So when you come in for a treatment, first we assess the grade of gynecomastia. We categorize it whether it's pseudogynecomastia or actually gynecomastia. Pseudogynecomastia is basically no gland but just fat deposition in the chest. We may or may not do an ultrasound to differentiate between the two. Once we assess gynecomastia, we do a thorough assessment of the patient to rule out any kind of liver disease or any other drugs that can cause gynecomastia, such as anabolic steroids or some cardiotoxic drugs. Usually I assess males in the age group of 18 to 20 for secondary characteristics which suggest hormonal imbalance which is continuing. If they have good facial hair and a good secondary development, then there is no need of doing any hormonal tests. But if there is any kind of suspicion of this, then we do go ahead and do certain blood tests to check the hormonal profile. Very rarely, I do ask for some blood tests to look for the hormonal profile to see if there's any kind of hormonal imbalance that is continuing even after puberty has passed. So once we're done with the diagnosis, the next thing is surgery. Surgery is the gold standard for gynecomastia. In surgery, what we do is something called as liposuction as well as gland excision, which means that we remove that gland. What we do in liposuction is we make small concealed incisions in the chest and we liquefy the fat and then remove it through the same incision. Now, if there is a lot of glandular tissue that does not come off with liposuction, then we make a very small incision in the nipple and remove that glandular tissue. All these incisions are concealed and extremely small and are never visible after the surgery. The surgery for gynecomastia is a daycare procedure, but I do advise my patients that they can stay overnight in case they feel more comfortable. The procedure is usually done under general anesthesia in terms of safety as well as doing it perfectly. What's the recovery like? After surgery, usually you have a tight dressing around your chest, and then within 3 days, we put something called as compression garments. This is basically to improve and quicken your recovery. The swelling that develops after gynecomastia is taken care of completely by these compression garments. You usually have to wear compression garments for a period of around 3 to 6 weeks, and this varies from patient to patient. You can resume your daily activities within 3 to 5 days of a gynecomastia surgery. However, any kind of heavy exercises or any kind of brisk cardio that gets your heart rate up, we usually prefer to start it after a month of the procedure. Gynecomastia affects men and younger guys mentally as well as psychosocially. They always refrain from going out wearing tight t-shirts, going to the pool, going to the beach, because they're very conscious about their chest. So you're still thinking that gynecomastia treatment is cosmetic. No. In many men, gynecomastia affects their mental health, their confidence, their quality of life. So it's a medical treatment. It's not vanity. So if you or someone you know is struggling with this, then don't brush it off. Speak to a qualified surgeon, understand the problem, and then go ahead with the treatment for this. There is no shame in wanting to feel confident in your own body. So you got any questions, then drop them in the comments, like, share, and break the silence on men's health.